Now that's incredible because it's now 1996. We've had 7 years of the hepatitis C test and we've only diagnosed 5,232 people. We had 40,000 transfusion hepatitis on file. We know we've had several thousand non-A and Bs on file. So what's happened? Nothing. Absolutely nothing. They know. They've admitted there's 15,000 blood backwards to 1982. They've already admitted there's 5,000 haemophiliacs infected. They've already admitted there's thousands of dialysis. The 5,000 that they got were drawn 94% from drug clinics only. The tiny handful of tests they did, the only question they asked how you got it was, are you an injecting drug user? 80% of the time, the person visiting the injecting drug user clinic will come turn around and say yes. Ever since this document was printed by Ramsey and Balcom, they've come through with this, it's 80% an injecting drug problem. This is a lie. You have to throw away 380,000 healthcare infections to even begin to make it work. And this is what they're doing right here. It's quite terrifying when you actually study this. I have to go to Scotland to find out about UK prison blood. The Scots have kept all their records and they have letter after letter after letter written to our government. 83, 84, 85. There were even letters being written in the 70s, early 70s. These were letters written to Lord Owen. Lord Owen had his box broken open and burned, so we don't see them. But the biggest concern is that here we see Scotland coming out about its prison blood supply, coming out about its catastrophe, and it's doing it literally without England noticing. One of our biggest problems is we're letting the prisons become completely out of control. Prisoners break out to buy more drugs to break back in. Every injector that walks into a prison with an injecting habit will infect 3 to 10 more people. This has happened for the last 34 years. And worst of all, when they leave prison, very often they'll sell the syringe and it'll go through another 500 people. It's a terrifying thing. So we're basically looking about, I think it's 6 to 8% of prisoners having HCV. And it's basically a factory, a Hep C factory. It just refines people and sends them out. And unlike the American military, it has no ownership. It calls these people injecting drug users. They're their prisoners, actually. And one thing we do know is almost none of them have been tested yet. Now, we're just looking at a contrast here of the two, which is France and England. Now, France told its nation we have 1.2 seropositive. And this was published in France in '94. This was front page news. 500 to 650,000 people had Hep C, 60% transmission by blood or healthcare products, the rest mainly drug use. Put posters everywhere, get tested everywhere. Carl Bruno marches around opening their anonymous testing centres in the high street. 92, Department of Health says Hep C is new and does wait and see. How can anyone invent a strategy called wait and see? Every country which has been completely out about hepatitis C has seen a national decrease in alcohol use. One of the signs that your Hep C campaign works could be said to be you've got maybe 1 million teetotal households. It's the same epidemic, but what are we hearing is the complete opposite. The dead silence about the healthcare superbug reality has left us with what? People with tattoos, people who inject. These are the people who've been asked to come forward for testing. And what I'm not seeing is patients realising their risk. Now we go over to the European model where they've done reports on individual surgeries. Now, surgery in Germany had a very, very clean blood supply. As you read through these conclusions on children who undergone cardiac surgery in Germany, still 1 in 7 infected. People that went for these products before '94 are in real trouble and need to test them. Canadian prevalency, and we use medicine the same way that Canada does, would see at least 25% of your infections. So if we're looking at about 140,000 infections per decade from blood, you could be looking at another 70,000 from dialysis. This study by De La Tour 35% transplantation surgery, or 92. We might be slightly lower than that. We'll probably be 20%. But again, you're looking at some serious problems there. Here we are, the French, better part of 10, 15 years ago, tracking all transplant survivors and determining who is infected.